Hospitals continue to deal with staffing shortages around the valley. In fact, Nevada Governor Steve Sisolak is calling on student nurses in Nevada to apply for apprenticeships to help fill the void. Thankfully, we have a lot of nursing programs in Southern Nevada. One of those here at the UNLV School of Nursing. In fact, the students here get to train at the Clinical Simulation Center, getting them hands-on experience before they head to a hospital. Nurses, they're the backbone of our healthcare industry, but the last 2 years have been brutal for these workers, risking their own safety to help those in need in the midst of a pandemic. And while nursing shortages are nothing new, UNLV School of Nursing Dean Angela Amar says they've intensified. Coronavirus has pushed nurses to their limit.
And usually we used to see burnout as like about 5%, it's up to about 50%. And that's actually has increased costs to the hospitals as well, by having to have new people hire, get them onboarded, all this stuff.
But while nurses are leaving the field in record numbers, you may be surprised to hear nursing program enrollment is up. In fact, pre-nursing is the most popular major on campus right now, and the field is competitive.
We turn away nursing students every year. And it's really, we have limits on our enrollment, and that's because we have to put them in groups and take them to the hospital, and we need faculty with them. And we don't have the faculty that we need.
So why become a nurse? We asked local student Katie DeMaya. She's a fourth-year Level 3 student with UNLV's School of Nursing. She has continued training in the midst of this pandemic. Her grandmother, father, and mother, all nurses. She admits it's hard seeing other working nurses burnt out, and it has caused her to question her career path.
At the end of the day, we still need nurses, and just because it's difficult right now doesn't mean my career is over as a nurse. The one thing that really made me want to continue being a nurse was, I want to say about June 2020, about 4 or 5 months into the pandemic. My dad, he works as a rapid response nurse at Sunrise Hospital. He was working with COVID patients and he became sick with COVID. He had to be hospitalized and he almost died. So, seeing that firsthand as someone, my dad goes in, my mom goes in, they get sick, almost die, keep going and still want to get back into nursing. It's really like it's motivating for me.
The nursing program is challenging, but it's one of the few industries where getting a job after graduation will definitely not be a problem.
A lot of hospitals really do need med-surg nurses, they need ICU nurses, they need the nurses who are going to take care of these COVID patients. And I might not be able to pick the floor, the unit that I want, but I will always have a job.
One of the biggest challenges is keeping local students here in town. Traveling nurses can get paid as high as $250 an hour. But Katie says while it's enticing to follow the money, serving her community is a priority. And thankfully, most UNLV nursing students feel the same.
Who's going to take care of your community if we're all leaving?
UNLV School of Nursing, over 90% of our graduates stay in Nevada. There's still more openings than we can fill.
Katie also just applied for the nurse apprenticeship at Sunrise Hospital. Governor Steve Sisolak is urging nursing students across the state to apply, saying they will expand the program to allow more room, anything to help fill the void inside of our hospitals. Luckily for Katie, she has some experience. UNLV offers training at this place, their Clinical Simulation Center of Las Vegas, used for both the School of Nursing and School of Medicine.
In the simulation center, have students practice high stakes things but in a low stakes environment. So mannequins can do just about anything. We can make heart rates, we can make them loud, we can make them soft, we can make them off, we can make any kind of thing happen. Mannequins can talk. We can produce what their vital signs would be. We can produce other kind of testing. So students are able to walk into a situation, interact with a patient, whether it's a mannequin or sometimes we use standardized patients, and are able to have to act and do.
The simulation is pretty close to the real thing, all controlled behind the scenes. The center has 5 simulation rooms that recreate specific hospital rooms. A technician changes the mannequin's reactions based on what the students do. Tons of scenarios are possible, from seizures like what you see here to childbirth. The list is long.
But in the simulation center, we can let them make the mistake, learn from the mistake, correct. And a big part of the learning comes from the talking about it after, the learning like what went wrong, what should I've done differently. We have students who observe and students who do.
They put us through a situation in which you have the opportunity to experience a code. They usually have 2 of us go in there, and what will happen is they simulate a code and you have to experience, a patient who has died, and you have to respond to this code. And that was probably both the most scariest and it was a very fun experience on the simulation of what it actually feels like to have that adrenaline in a code type situation.
And while these resources are great learning tools, graduating more nurses will continue to be a challenge if more money and faculty aren't found. The dean and other leaders are continually working to attract new students.
Compassionate people, caring people. But I'd also venture to say that nurses are smarter than people give them credit. You take a really hard curriculum that is very heavy and focused. You've got to be a good thinker. You walk into the room and you've really got to be able to assess what's going on in the room with your patient, with their family. You've got to figure out what is the key problems.
These are the heroes we need forever. You always remember your nurse. Katie is hopeful she too will leave that lasting impression on someone and encourages those thinking of pursuing nursing to go for it.
Anyone who's interested, just try it. Even if you're scared, I think nursing is very rewarding and a very educational degree to have. You have such a wide range of areas to go into, and the possibilities are endless.
Well, after years of hard work, Katie should be graduating in August. We wish her the best of luck in her new career. All right, that's going to do it for Trending Vegas. We'll see you next time.